on! The building's being evacuated! Close the hood sash!
Attention.
You grab the emergency response guy, let's go!
Emergency has been reported in this building. Please cease operations and leave the building utilizing the nearest exit or fire exit stairway. Do not use elevators. Repeat, do not use elevators.
Hello, Mrs. Nelson. I'm EHS Officer Oliver Sparks, and I'll be escorting you on the premises today.
Miss.
I'm sorry.
Where?
Right this way. I can assure you, ASU is host to certainly some of the finest laboratories in the state, and some of the best safety procedures. Here we are. Now before we go in,
Not my first time. Safety glasses, closed-toed shoes, lab coat, got it.
Detective Josh Stewart, Melanie Dunsky. They will be reporting on the condition of the lab today. My team and I believe that certain protocols might have been overlooked.
Blunt force trauma makes this a police matter. A possible lab accident makes it yours. Until we sort that out, we'll be handling the investigation together.
Oh, well, the room's pretty clean. Our hazmat did an excellent job neutralizing the chemicals that caused fire. But with that said, there's not much evidence for us to go on.
Well, what I want to know is what she was doing here alone in the first place. I mean, she's a grad student.
Well, undergrad.
Undergrad in biochemical engineering. She's got to be the last person to screw up something as important as lab safety.
Well, so far we don't know. Everyone knows she shouldn't have been, but no one seemed to mind at the time.
If someone knew she was here, then she wasn't alone. Anyone particularly intent on harming her had this well thought out. Knowing she'd be here left her vulnerable. Once she was rendered unconscious, our suspect probably caused that chemical fire to cover his tracks. Whatever drove someone to want to kill Miss Dreyer.
That's not a conclusion we can make just yet.
Why's that?
Well, because following good lab safety procedures saves lives.
Alice and I were more than just friends. And if I had known that she was alone in the lab last night, I would have been there. We never kept secrets.
She was one of my best students. I trusted her with my research. She would never have gone in there alone, knowing the possibility of an accident.
Seriously, I was just focusing on my work. Next thing I know, we were being evacuated. That's everything I know.
Nobody came in and out of that place without our system knowing about it. The entry to that building is keycard access only.
Our lab compliance officer is Dr. Kendra Lee. And yes, I was wearing my goggles, closed-toed shoes, and lab coat. We all were.
She had an enormous amount of responsibility. If there was anything she was hiding, she never confided in me.
Sparks.
Hey Ellie, we got you on speaker. Mel and I just finished our report, and despite the numerous... Yeah, Ollie, we found a sandwich in the fridge. A sandwich. Anyways, despite all the infractions, we did manage to scramble some concrete data. Turns out there was a large spill of hydrochloric acid right next to the victim on the concrete, and trace indicates that there's a second compound present, ammonium hydroxide. When the two meet, it tends to produce toxic vapors.
So where did the second chemical come from?
Not sure. It wasn't on the chemical inventory, but there is a good chance it was supposed to be delivered, but the check-in sheet was burnt up in the fire.
Convenient. How is any of this useful to me?
Actually, here comes the cool part. So I plotted a detox from a sample of the victim's blood. The half-life of the vapor cloud is somewhere between 8 and 10 p.m. Now, Mel went ahead and grabbed the key card information.
The system indicated that only 2 people entered through there, a Dr. Linda Manning and a Spencer Moore. I hope that helps.
Thanks. Anything?
Just a lot of necessary redundancy. But if I have to hear another word about lab protocol, I swear I am going to get an ulcer.
Well then, I think it's time for us to see a doctor.
How can I help you?
Dr. Manning, were you aware that Alice was working alone with hazardous materials in the lab last night?
I am aware of the incident. Anna's policy dictates I'm in the process of writing my 72-hour report.
How can you be sure it was an accident?
What are you implying? I was told it was just a chemical spill. You know, an accident.
Well, we need to consider everything at this point. The victim actually took quite a blow to the back of her head. And were you aware that your spill kit in your lab was not properly stocked? And the fume hood has too many materials stored in it. And your lab safety training records, they're not up to date. And your emergency eye wash, it's blocked. And your lab safety registration has not been annually updated. And one of the emergency contacts you have listed have not even worked at ASU in 3 years.
Well, you have to understand the tremendous amount of pressure I'm under to achieve grant acceptance and then how understaffed we've been for the past couple years.
Be that as it may, Doctor, all of these findings were identified on your lab inspection report last year and have not yet been corrected. These several issues that Officer Sparks mentioned have not only complicated this investigation, but may in fact be the cause of the incident.
But I thought you said she was attacked.
We never said she was attacked.
We can't verify the source of one of the 2 chemicals in the incident. The chemical label was not completed according to our chemical hygiene plan. And our lab people tell us that it's ammonium hydroxide.
That's not extremely volatile, but we do have it delivered for select projects.
We just need to know where it came from.
The only place on campus that stores it and supplies it to the other labs is Building 53G.
We can identify this chemical most easily due to its specific property, the benzene ring.
Steve Peterson?
Yes?
Mind stepping outside with us?
Right this way, please. Sorry about that. We'll get it cleaned up properly. What's this all about?
We have a couple of questions regarding a specific chemical that we've been told most likely came out of your chemical inventory. We also have evidence that it was not properly labeled per the chemical hygiene plan or contained for transport.
And what chemical is this?
It was ammonium hydroxide. We don't know exactly who delivered it, but we know it ended up in the ISTB1 building.
I don't have to look that up. That was just last evening. I had one of my student workers, Spencer Moore, make that delivery. It was one of the last deliveries of the night. He should have been using proper carriers. We always utilize proper carriers for transporting chemicals. In fact, I have some right over here. What?
Where's Spencer Moore now?
Do you recognize her?
Yeah, that's that girl on TV. The one who got into that lab accident.
According to Professor Peterson, we understand you were in the ISTB1 building last night?
Yeah, I delivered a box, I signed out, and then I went to see my girlfriend.
We need you to be a little more specific. Alice received a massive concussion, and your delivery was directed to her lab.
No, she signed for it and she was fine. She's alive.
Do I know you?
I can't say that we've ever met before.
How are you feeling?
About as good as you could feel, I guess.
Do you think you could possibly tell us what happened that night?
Yeah. I was working. It was on a lab project. We were supposed to get together, but that night my other lab partners couldn't make it. Well, I know I shouldn't have, but I thought I could get more done on my own. I left the Bunsen burner running. I remember accidentally knocking over a container. Before that, I cut my finger and knocked over a vial of hydrochloric acid. I went for the spill kit, but the one in the room didn't have everything I needed, so I put on the proper PPE lab coat, and when I got back, when I returned, I remember feeling dizzy. I think there was something else on the floor, too. Last thing I saw was a flash. And then I'm here.
So you didn't see anyone? And there was no one else in the lab with you? And no one approached you at all?
No. I must have hit that table really hard. How long have I been out?
Quite a while. All things considered, you're lucky to be alive.
My team determined a mixture of hydrochloric acid and ammonium hydroxide probably created a toxic environment which made you dizzy. And then when you fell to the floor, the Bunsen burner that was left unattended probably got tipped over and burned the delivery sign-in sheet, which eventually alerted us to you. You know, you're very lucky that the Nomex lab coat you're wearing probably resisted the flames long enough for you to survive the accident.
And I know I should have listened and followed what I learned in my lab safety class.
At least you're in one piece. We've heard from your family, and they'll be here this afternoon. Now get some rest.
He lied. Spencer said she signed out his delivery.
I know.
I thought we went through this already.
We did. We just feel like telling you that you're right. Alice is doing just fine. So well, in fact, that she's probably going to press charges. You know, an unsuccessful murder still lands you in prison.
I didn't do anything.
You lied. Alice didn't sign for your delivery. In fact, Alice didn't even see you.
A clean confession might ease your opportunity for parole. So what happened?
No, wait. You have this all wrong. Look. I didn't deliver the chemicals. Alright? My girl, she came over to visit me and I wasn't even near the building that night. I had my buddy Kyle deliver it for me. I mean, I gave him my key card and I thought he couldn't possibly screw this up.
Assuming your alibi holds, why didn't you tell us about Kyle sooner?
I figured that since she was alright, you know, no harm, no foul.
Oh, and since prison's not a career choice of yours, now you decide to rat him out? That's a really nice, thoughtful, and friendly gesture.
We're gonna have to bring this Kyle in for questioning. Where is he?
I don't know. He's on the rooftop. I cut the lock. I mean, he kind of freaked out. I figured he'll be safe there, you know, until this whole thing blew over. Until I got control of the whole situation.
Kyle! Kyle Kruger! We know you're up here! My name is Detective Madeline Nelson! I'm with EHS Officer Oliver Sparks!
Just want to ask you some questions!
There's nowhere to go!
Calm down, kid. We're not here to hurt you.
Not here to hurt me! You're here to ruin my entire life! So I made one mistake. I dropped a box of chemicals accidentally. And now it's all over?
An accident's an accident, Kyle. After all, nobody died. Kyle, nobody has to.
Why not? It's over for me! You may be able to go home to your wife, your kids. Not me. There's no going back to normal after this.
That's not true! You are not the only one to blame! This situation is bigger than just me and you! Everyone screwed up! Your superiors, your friend, even the victim! All of this could have been avoided if everyone took their responsibilities seriously!
So it's not just me? Was it just my fault?
No! Kyle! It wasn't! All's well in Wonderland?
Alice is just fine. I can promise you, everyone involved in this whole process will get a strict lecture on lab safety. I mean, look at what we learned here. Using personal protective equipment, good lab safety training, and following the chemical hygiene requirements definitely prevents accidents.
Nearly every level of this infrastructure suffered some fault. You'll need to stress everyone's significance. Might need to reboot your methods then?
You're right. We're all part of a team, a mini city of people working together to advance and transform ASU into the new American University. We are all asked to rise to the challenges of our pursuit for education and research that contributes to the public good. ASU must assume a major responsibility for the economic, social, and cultural vitality of the communities that surround us. We have created a place that inspires risk and innovation, while keeping everyone's safety and our commitment to the environmental sustainability at the forefront. ASU's Environmental Health and Safety Department provides guidance to the ASU community through innovative programs and technical services that promote safe and healthy environments for education, research, and community outreach. Even though we may not see all the gears turning or why, none of us can escape our responsibilities, especially to our own personal safety and that of everyone around us.
You've got a big job ahead of you, Sparky.
We all do.
Mm.